Namaskar everyone, very good evening. And today, as we know that it is a World Hepatitis Day, I would like to share some information in order to help this global movement uh, to attain or achieve its goal. The theme this year is bringing hepatitis care closer to you. As we all know that hepatitis is of five types: A, B, D, C and E. So hepatitis was discovered by Nobel Prize winner Dr. Baruch Blumberg in 1965. The A is caused mostly by the infection caused due to the food and water. The B is caused due to the body fluids and different kind of blood infections and all. C is also caused due to the same reasons, the blood infections and getting in touch with any of the infected person or the vaginal secretions or the semen. And D is caused due to the local food contaminations and exposure of E virus food or contaminants. The hepatitis E is caused. Okay, so there are almost 30 every 30 second there is one person dying due to the hepatitis B and C. So I would like to share some quick symptoms that to identify if individual is suffering from hepatitis B or C. Certain kind of hepatitis, they are certain like flu like symptoms wherein you have cold, cough, fatigue. There will be the dark urine, the pale stool, the eyes and skin will be little pale, just like in the jaundice. So you have to be really very careful, and also if there is any kind of unexplained weight loss also, you have to be really careful and get yourself checked in that condition. Now prevention is better than cure. So what you can do to prevent, so vaccination is the first prevention tip that we all can do, and hepatitis B is compulsory for all the newborn children. So make sure that anyone around you having a newborn is vaccinated with hepatitis B. Others can be you those who are not vaccinated or not can just prevent themselves by reducing the exposure. So as we know that the hepatitis B, A, C, D is caused due to the transmission through the contact. So you can just reduce the risk by not sharing your needles, not sharing the syringes, not sharing the razors, not sharing the toothbrushes, not sharing the tattooing in that needles, that also to be sterilized before the reusing. And also don't touch any of the spilled blood anywhere. Also taking care of the hygiene for hepatitis A and E is very important. So use the safe water, use don't use the frozen ice which is sold anywhere. So just make sure that you are procuring it from the safer place. The raw vegetables and fruit should be cleaned well before the use, and also the uncooked meat and fish and oysters should be cleaned well and taken care. You can just cook or wash it properly in order to avoid those things. So see, the hepatitis is actually responsible for a lot of chronic liver diseases, cirrhosis, cancer of liver, and also even death in certain cases. As I have already mentioned, that every 30 second one person died due to hepatitis B and C. So this was just a small effort from DADOC to help people to prevent and understand the hepatitis and make this world more safer and more better to be lived. With this I would like to end, and there is a disclaimer that I am not giving you any kind of a medical prescription or something. Please visit your doctor or a clinician for the further diagnosis and treatment. Thank you so much. Namaskar.